Great, thank you so much. Hi, I'm Drew Schiller. I'm the co-founder and CEO at Validic. So I'd like to give you a quick background on what's happening today in technology. So this is an image from 2005 at the introduction ceremony for Pope Benedict. Large, massive audience. This was the introduction ceremony of Pope Francis in 2013. Just 8 years later, something happened. 2005, 2013. All of us got personal computers in our pockets. And the world changed in that short amount of time. And the question that I have to ask for you all is, how much did your business change? We are all in a business where engaging the patient is critical to the future of our success. And yet, the patients changed the way that they interacted with the world around them, but the way that we run clinical trials, that we investigate new drugs, the way that we even just provide healthcare did not really keep up. And that's what my company, Validic, is helping to solve for. So Validic is the leader in connecting patient-generated health data from digital health apps, wearables, and in-home medical devices into the healthcare system. We connect with over 400 disparate sources. These are your wearables, your health apps on your phone, as well as FDA-listed devices like blood pressure monitors, glucose meters, pulse oximeters, really anything that's happening outside the four walls of the traditional healthcare system. Validic helps to capture that data, and we standardize and normalize it and provide one simple connection into the healthcare system. So we work with companies across the healthcare industry. We work with many folks in the provider space as well as the healthcare IT space, including EHR vendors. And we also work with many pharmaceutical companies. And we work on, sorry, there's some water going over here. We work with many pharmaceutical companies around driving clinical trial innovation, speeding recruitment, et cetera. So I want to talk to you a little bit about where our company is today and then where we're going. So our company's mission is to improve the quality of human life by building technology that makes personal data actionable. Everything that we do, we want to enable a frictionless healthcare system for the patient in terms of clinical trial participation, in terms of participating in their own healthcare, in terms of getting better care. We are headquartered in Durham, North Carolina. We have 54 employees. The vast majority of us are in Durham. We have raised $18.1 million to date. And we have some really exciting technology. One of the really interesting things you'll note here at the bottom is that we have OCR technology that we have patent pending. Effectively, my job is to get data in a frictionless way from anywhere where patients are collecting it. So we go cloud to cloud, we go directly to Bluetooth devices, we hook up into app ecosystems like Apple Health or Samsung S Health. But we had a real problem where there's legacy devices in patients' hands today. These are glucose meters, blood pressure monitors that people purchased at a retail pharmacy 5 years ago, 10 years ago, that are still in use today. These are durable medical goods. And yet there's no way for the data to come off of those devices to be accessible into the healthcare system. So we invented a patent pending technology where you just simply, just like you can deposit a check with your phone, you can now take the phone, use the camera, read the screen of the display on that device, and it turns it into a digital asset and delivers that up through our system. So it enables a very fast and efficient mechanism for capturing data. So this is where we are today. Validic's platform enables intelligence, it enables patient engagement, and it enables personalization. And it's really this personalization piece that I see as the future for where we're heading. Validic is really working toward delivering on the N-of-1 promise, being able to actually engage each individual consumer exactly where they need to be. And we're working with a lot of folks in the clinical trial space, especially, to start to drive endpoints around how can we actually leverage these devices in clinical trials that are available for FDA submission. And this is one of the biggest challenges that we have today, is that not a lot of research has been done in this space in order to actually understand how to take all of the data that's being generated from consumers in the real world and bring this back into the healthcare system. The traditional healthcare system is very episodic, right? Encounter-based, patient comes in, readings are taken, patient leaves, maybe there's a survey once a day. My system, we don't have an episodic model. In fact, I don't even understand the concept of an encounter in my system. All I see is continuous data flowing from patients day in and day out. And that's a real opportunity. So one thing I'd like to highlight that we're doing around this is that the ONC, the Office of the National Coordinator for Health IT, recently contracted through Accenture Federal Services, Validic, and Sutter Health, which is a large integrated delivery network in Northern California, to create a pilot demonstration for how patient-generated data can be useful in healthcare. So we're connecting, these are type 2 diabetic patients, many with multiple comorbidities, and we're connecting glucose meters, blood pressure monitors, weight scales, and activity trackers into the healthcare system, into the EHR, and it's delivered up through the workflow for the care coordinators so they can prioritize patient care. One of the most amazing things about this whole pilot that we've been doing, which has been phenomenal, has been that we got to do a site visit and we got to actually speak with some of the patients who were involved in this. And I'd like to tell one story explicitly. So there's a gentleman, he's in his 50s. Every single person who has ever been type 2 diabetic every person who's ever turned 40 in his family has developed type 2 diabetes. He turned 40, he couldn't avoid it, he got type 2 diabetes. His father, his brother, his sister, his grandma, and then him. He exercises every day, he eats healthy, he cannot control his A1C. So his whole model of care, what he would do is he would take his glucose reading 5 to 7 times a day. It would go somewhere into some app. He couldn't get into the doctor. So he would print out a PDF once a month and fax it to his doctor, who would receive it and immediately discard it because it was not actionable data. He got into this program. His glucose readings started flowing directly into the healthcare system, which that in and of itself was amazing for him. He was just glad someone was looking at it. But what he found was that 2 weeks into the program, the diabetic nutritionist in the program called him and said, hey, things are looking great. Your food's looking good. You're tracking your glucose levels. But something's going on between 7 and 9 p.m. because your glucose is spiking, and we can't figure out what that is. Can you figure it out? And he said, you know what? It turns out I'm a snacker. My kids are in college. They live at home. They're at home in the evenings. We're watching sports. We're watching the game or TV. There's chips. There's popcorn. I grab a handful of popcorn. I just eat a little bit. And that was enough to throw his levels off, and he didn't realize it. So he cut that out through that program. He saw the insight, he cut that out, and within 30 days, his A1C dropped by 0.5 point. And so that's the type of care that connected device data, just simply getting the data to the right place, can actually provide. And that's the type of future that we're delivering at Validic. Thanks so much.